To some health matters now, and a section of health workers' unions is demanding an apology from the Inspector General of Police, Douglas Kanja, over what they term as police brutality meted against their members who held demonstrations in Nairobi on Tuesday. The unions are also threatening to sue the National Police Service for allegedly infringing upon their rights to exercise peaceful demonstrations. Through their leaders, health workers are warning all services in the sector will be paralyzed should the government fail to absorb universal health staffers on permanent terms.
Solidarity forever.
The push and pull between health workers' unions and national government persisted on Wednesday, with union leaders accusing the government of orchestrating the stalemate, which threatens to derail universal health coverage by discriminating and ignoring their plight.
It is actually ironical that a government would be saying they're employing people to help them implement the universal health coverage, but on the other hand, they deny them their rights.
When these healthcare workers were recruited, they were recruited with other cadres, the doctors. As we are speaking, the doctors got P&P and they are comfortably working. So the problem that we have is the people that are advising the CS to discriminate us against the doctors.
According to the leadership of the clinical officers, environmental and public health and medical lab officers unions, the Ministry of Health assertion that it lacks 3.5 billion shillings to employ UHC workers on permanent terms and harmonize their salaries is debatable.
So the confusion which is there is when the ministry says that we are going now to actually send the payroll to the counties, to the owners of the contract. Who is the owners of the contract?
The budget that we are requiring to absorb both the UHC and Global Fund is merely 0.01%.
They also rejected plans to transfer their payroll to counties, terming it a scheme by the national government to evade its responsibility to safeguard their welfare. The health workers' unions have also taken issue with the 11-month salary delay for medics under the Global Fund program. Additionally, the unions have strongly condemned what they termed as brutal force used by police officers on peaceful protesters.
Hatuwezi tukakubali watu wetu wanagandamizwa. Mtu anakuja na rubber bullet, askari anakuja na rubber kupiga mtu ambaye anaandamana peacefully.
And we are giving them 14 days. If we don't have a report on the action that has been taken on the officers, we are going to sue the IG so that they can pay the damages.
Joseph Ohungu for Prime Edition.